Roger's goal is for every patient to achieve an improved quality of life. We want to be able to quantify the progress that patients have made. The goal of the research center is to really explore and understand how we can push the boundaries of evidence-based care so that patients can get better faster and have longer lasting results. And we can really identify the right treatment for the right patient. And that's kind of the basis of all the work that we do.
We are really at the very earliest stages of understanding genetics within mental health care. When you look at oncology and cancer, any patient that's being treated, they typically will have genetic tests run. Certain medications are given based on the results of that analysis. We see that more and more with heart disease. We see it in other aspects of cardiovascular medicine. We're starting to see that with different types of rheumatology diseases and almost any other place in medicine except for behavioral health. And it's time that we fix that. And one of the key things that we are looking for are genetic risk factors that may suggest that someone may develop a particular behavioral health condition. More importantly, is we start to understand how some of these behavioral health conditions overlap. We call them comorbidities. Genetics will help us really unlock the information. Is that kind of a nature element, or is that nurture? Is that just how someone grows up or something about their environment? We really don't know yet.
There are a lot of academic research centers that are looking at the genetic basis of mental health. One of the challenges though in doing that research is, like I said, you need the DNA, but you also need kind of the clinical experience and the diagnostic information. So Rogers really brings that latter part to the table because we've been treating so many patients for so long and our patient volumes are so high, and then we're also we're working with patients all over the country. So we've already got that phenotype and that medical record. And the goal for us now is to pair that up with the actual DNA.
This will be one of the largest biobanks in the world that's focused on behavioral health and addiction. We will store over 100,000 patient samples. And the great thing is we make those samples anonymous for our patients. So there's no link to any patient names or identifying information with the genetic material. But we're able then to use those materials, understand the condition that someone may have, like OCD, or depression, or anxiety, and then form studies that utilize that information.
We've been blessed with really generous support from a number of donors who see the vision of the research center. So the research center itself is supported through philanthropy and then also grants, and Rogers Behavioral Health as a system contributes operating budget to our programming. And then the biobank was really made possible through the gift of a donor. The equipment that we have in the biobank is all state-of-the-art. We have robotic capabilities there. So again, that would not have been possible without the support of the donors that really understood and embraced the vision that we had.
As we start to understand the genetics, our goal is to really get the most promising treatments or ideas to patients that keeps us up at night. We know that every day that we spend not finding an answer is an extra day that someone spends suffering from a particular condition. And I think the biobank is really leveraging all of the patient resources and data that we have to start working on the next wave or generation of patient care.